Welcome back to another episode of Sage Connections. Today I'm joined by Dr. Derrik Faunt, a skilled physical therapist who brings a unique perspective on how the insurance system shapes the way we deliver care. Physical therapy can look very different depending on whether a practice is insurance-based or cash-based. And even though Dr. Derrik and I operate on different sides of that spectrum, we actually agree on far more than we disagree. I'm really excited for this conversation because we're pulling back the curtain on what the insurance model actually looks like, how it affects patients, how it affects clinicians, and why so many PTs are rethinking how they work. We're going to talk openly about the benefits, limitations, frustrations, and opportunities within each model, and hopefully bring clarity to a topic that impacts almost everyone at some point in their healthcare journey. I can't wait to dive in and explore how we can better support our patients and our profession, even when we're approaching it from two different angles. Enjoy. We're both physical therapists, but we
Mhm.
practice in slightly different models. You practice within the insurance model, and I practice in the out of network model. So, why did you choose to be in network? And then I'll talk about why I chose to be out of network.
Perfect. Yeah, it's kind of a journey. I feel like I didn't want to at first, but when I first graduated from physical therapy school, I worked in an outpatient corporate clinic that would accepted all of the insurances under the sun. And we'll get to why that's a problem in a little bit. But I just saw a lot of problems within that model, mainly seeing a patient for 10 to 15 minutes, like myself. I felt like a manual machine. Like I would work on somebody, move to the next table, 10, 15 minutes, and literally just all day. 20, 25 patients in an 8 hour day. Um, and I was able to get people better, but I wasn't able to get people better at the rate that I wanted to because I wasn't able to watch them through exercises or I didn't have access to all like the any modalities to help me out in any way. When I saw all those flaws, I was just 2 years in, and I was fed up with it. I was fed up with my hands hurting, and I was fed up with the patients not receiving the care that they needed. So I actually started off in out of network model, um, mainly being cash based physical therapy. But at that time, I was a mobile physical therapist, so I was going to my clients' homes and then treating them like outside of their gyms and things like that. And that worked for a while, but then I felt like I was limiting myself in how many patients that I could serve. Um, because like just I would see like 5 to 6 people max in a day, and that like took all day because of travel time and things like that. So then I got a clinic here in Royal Oak, and the first like 6 months I was still cash pay, but it was just like trying to keep people like coming in on a regular basis. I started to just see a few barriers with like the affordability of that care. And that just got me thinking, like reconsidering things like how can I make myself more accessible? Um, and that's when I started looking at a few different insurances. Blue Cross was the first one that we took because the reimbursement rate's actually pretty fair. Um, it's getting worse. So that was 3 years ago is pretty fair. It is reducing. Um, but I wanted to make myself more accessible to patients, and that's why I started exploring various different insurance companies. And then now we take all of the major insurance companies, but we still see a solid amount of like self-pay people as well. So I would consider us more of like a hybrid model, trying to work within this dysfunctional insurance system.
Yeah, and I think a lot of us come from the same world. I think we all kind of graduated around the same time or within 10 years of each other and had that experience of working for a big corporate company where you were expected to see, sometimes, two people an hour, sometimes up to four people an hour. And, at a certain point, you're just directing traffic more than you're actually helping anybody.
Absolutely.
Um, so same thing for me, I think we, come from the same place. And when I went more into the pelvic health route, I realized that, I do have to be one-on-one with everybody. I can't
Mhm.
send them off to a gym or to a room to do their own exercises. This is very, sort of tailored care to the individual, and there's a lot of cueing involved, and it's a lot of little adjustments and a lot of it's really individualized essentially. And I knew that
Absolutely.
I couldn't do it while also taking insurance. Now, you're right, Blue Cross does reimburse relatively well compared to other ones.
Hmm.
Um, but at the same time, you know, it's not always easy to get that money, to
Yeah,
get paid.
sure.
So without the assurance of volume,
Hmm.
um, I think it's difficult to operate as a practitioner. Um,
Absolutely. And especially like in pelvic health, like you were saying, that's a whole nother ball game. We're primarily outpatient ortho. So there's some work ways to work around that.
mhm.
Um, but yeah, when you get into like internal and having to have that degree of queuing, you have to be monitoring at all times.
Yeah. Yeah, but I completely agree with you that there is a accessibility problem for sure.
Hmm. Sure.
And especially in the area that we're at, being around the big three, the automotive industry, most people in the area worked for companies, either those three directly or suppliers of those companies. So everybody was sort of in the automotive industry, and insurance was a very normal part of the benefit package for working for those companies. And
Right.
so everyone's just used to using insurance. And I also understand, like, why would you pay for insurance while at the same time pay out of pocket? You want
Hmm.
to use the insurance that you bought, but unfortunately, the coverage of that insurance it doesn't, I think, reimburse,
I,
for what we
y-
do.
yeah, and I agree, and I think you're spot on with like the automotive industry. Historically, I mean, and they still offer good insurance plans compared to like what's out there. But what we're finding now is, and this is happening year over year, and that's what brings up the bigger concern is how do we move forward? Because I feel like you and I, like we're anticipating, like we've been able to figure out our ways up till now, but it's anticipating like what's to come. Um, and what I'm seeing in trends over insurance plans, literally from 2022 to now, since we've been accepting insurances, deductibles are going up. The amount that these insurance companies are covering is going down. So therefore, the cost is more on the patient, and then their premiums are also going up. So they are now paying more for said insurance, but they're getting less coverage. So then now we're getting really close to this threshold of does it make more sense to pay less for my insurance premium and have like a catastrophic insurance and then pay self pay for services that I used to get covered? And that's getting tricky.
Well, and on top of the fact that I think in general, our society is moving away from working for big corporations into more a gig economy, people working for themselves, people
Mm-hmm.
finding alternative sources of income, or supplemental income. And so those big benefit packages that were available to most families even 10, 20 years ago is no longer available. So,
Absolutely.
but to get insurance for the individual or without the help of that company is very expensive. I mean,
Yeah.
I've heard up to, $2,000 per family of four, and that doesn't include the deductible, and that doesn't include co-insurances and co-pays, and
Right. Yeah.
so yeah. And then on top of that, you know, what kind of quality of care are you getting through going to a provider that takes insurance? I think all providers get into healthcare to help people. I haven't
Agreed.
met anyone who's just like, I just want to be rich and take advantage of everybody. I mean,
There's,
the
there's a lot
fulfill.
of better professions to choose if that's if that's what
Yeah,
you want to
yes.
do.
Yeah, yeah. I think all of us, this is our purpose in life
Hmm.
to be healers and to help others. Um, but at the same time, I think insurance right now incentivizes quantity of patients versus
Hmm.
quality of care.
Absolutely.
And it's a difficult thing to juggle for practitioners.
Hmm.
When we go cash base, it's not to punish the people that have insurance. It's to provide better quality of care.
Sure.
So speaking on that, so what do you think, we can kind of talk about like what does daily practice look like for you? And then I'll kind of talk about what it looks like for me. So what's a session look like for you? An evaluation.
Yeah. So, I mean, our evaluations are our one-on-one. And for the most part, we try to keep that outside of our end of the year craziness, like during the whole year. For the most part, we're like one-to-one with like a couple overlaps throughout the day. We definitely have been willing to take the hit on profitability to try to learn from this experience of how we find that middle ground of accessibility, profitability, and quality of care. So like we really tried not to like overload our schedule, and I'm fine with just not making as much because our motto has always been patients first, profit second. Um, and we're working on that. So back to your question, like the evaluation, they'll come in, they'll be greeted by our receptionist up front, Jackie, and she'll review their insurance benefits. And this is where we start to try to make our difference between like our family owned practice who takes insurance versus the corporate system that takes insurance, because we dig as deep as we can to find out any little loopholes that their insurance plan has. We try to fully understand what this insurance, what costs will be to that patient, so that we're as transparent as possible. That being said, insurance doesn't always give us the correct information, unfortunately. And there are times where like the insurance will kind of surprise us with how expensive things are. But because we don't have all of these layers above me, like up like in the corporate ladder, like we just work with the patient and try to figure that out. Um, so they'll go through all the benefits, and most of the time, there's no issues in the benefit side of things. And then the PT, myself or Anna, will go up front and we'll greet the patient, walk them back, and then we'll show them our space. We have a pretty large facility, and then we'll take them to the evaluation room. And we'll take about 20 minutes to really just talk to them. We don't even like do any testing or get movement quite yet. First 15-20 minutes, I need to understand, who do I have in front of me? Yes, I know you have shoulder pain or knee pain, but who are you? And I want to like start dissecting how they got to be where they are with this pain. Um, so that's something that that I'm proud of in our practice, is that we really take the time to understand the individual. And then we'll go into having them move around so we can do movement assessments. And then we'll get them on the table to try to start connecting some dots in the story that'll explain their pain. And then from there, we'll go through some exercises to get started on, and then kind of go through the full plan of care, and then schedule for follow-up appointments.
Yeah, it's interesting that you bring up transparency, which I kind of want to touch on in a little bit, but I think we agree on so much. Like we want to see who the person is in front of us because
Mm-hmm.
you can't just treat a knee or a shoulder. I mean, it's part of a human being. Pain, as
Yes.
we know, especially chronic pain, has a lot to do with nervous system regulation and stress and all that. And we have to see the individual and all parts of their life to truly treat them.
Mm-hmm.
Um, and so my evaluation looks very similar, except mine is 90 minutes because I do a very thorough evaluation. I do a treatment and exercise prescription at the end, and then I typically see people for about once a week for about 4 to 6 weeks. How often do you usually see people?
It depends on the case. Once to twice a week for a similar time frame.
Yeah.
And then like we always take into consideration like their costs too. So it's like if they have a high deductible or things like that, like we'll work with them, um, and to kind of like meet that person where they're at. So like
Yeah.
if they can't afford twice a week, well, we're not going to force that because like we want this to work for everybody involved. Because that's how we're actually going to be able to monitor this care longer and ensure that they get back to what they want to do.
Well, I think that's great because it goes back to that transparency piece. For the fact that you guys, I'm assuming you're saying you check with insurance to see what their benefits are and you help them in that
Hmm.
sense.
Yeah.
Yeah, yeah. And so you try your best to give them kind of generally speaking what their responsibility will be. In the
Right.
cash-based world, so the insurance world, the person has to meet their deductible before their insurance kicks in. In the cash-based world, the transparency is there. I mean, it costs what it costs. The initial evaluation is what it is. The treatment sessions are what they are. They never change. There's never going to be a surprise bill. You pay at the end of your session, or you can get a package and then you don't pay until the package is done in my
Mhm.
practice.
Sure.
And so I think there is, in general, that's a big piece that nobody talks about in healthcare, not just physical therapy, but
Hmm.
I think that's why so many people are in debt and bankruptcy because of medical bills, is because there
Yeah.
is no transparency. You break a leg, you go to the hospital, the emergency room, they treat you, they make you feel better, they patch you
Right.
up, but you have no idea what that's going to cost you. And then
Hmm.
people get a bill for thousands of dollars.
Right.
And they don't really get a choice, because number one, they're usually in dire straits if they're in their emergency room and they don't care
Right.
and they just fix me.
Hmm.
Um, but even if that wasn't the case, there's really no way to make an informed decision about how much money you're going to be spending for X treatment.
Sure.
So it's amazing. It's great that you guys do that, and I pride myself on doing that as well.
Yeah, it's super important. Like, it goes back to that meeting people where they're at. Like, and with the high deductible thing too, like we also, so this is where the hybrid kind of comes into it. Like we'll check in detail about their insurance benefits. And if they have a ridiculous deductible, we're going to be upfront with them and say, hey, no matter how many times we see you, we're not going to be reaching your deductible. So, like, if you don't have other health expenses going on, we have this cash rate and then we have this package rate as well. And people are so appreciative that we just have that to offer because sometimes that's saving them like twice the amount because what the insurance gives us for something is not what they'll stick the patient with. They'll
Right.
stick the patient with double. So we don't want to mess with any of that. So again, just doing our due diligence to ensure that we are setting this patient up for success because it truly is about healing, not about all of this unfortunate shenanigans that we have to go through.
Right. Well, that's interesting that so I don't think a lot of people know that what insurance is billed and what the patient is responsible for is
Mm-hmm.
actually what the provider is getting reimbursed.
Right.
And that it can be, double. I mean, I don't want to throw out numbers, but it
Like
can.
it can be high. I mean, let's say the insurance gives us like $130 for the session or something. If that were to get denied for some reason, which we've never had this happen, but like this would be if you went to a corporate PT clinic and they didn't scrub through your insurance plan for you, and that got denied because maybe that clinic was out of network, they're not going to get charged that clinic would have gotten $130 for the session. They're going to get stuck with a $300 bill for that session. And that's the scary part when we get into those larger healthcare systems and the corporate PT clinics, the hospital systems. Like, they aren't checking that for you. So if you don't know your insurance plan in and out, then you may get stuck with some of those surprise bills.
Well, how many people do you think truly understand what their insurance benefits are?
Not enough.
Not
Nobody.
enough.
Probably 90, mid 90% do not know how what their insurance covers.
Right. Right.
Yeah.
And yet there's this level of fear that we all get
Hmm.
to get insurance because it's what you do and what happens if you don't have it. And and I think, yeah, I think there's not enough information about what it actually is, what it actually covers, and how much of it is actually your responsibility.
Yeah.
Because even though they're a non-for-profit organization, they should be, they still want to pay their own bills and they still want to pay their own employees and people.
Hmm.
And, you know, if we're talking about a business, it's not in their interest to give you, to pay out more.
Right. It just makes, yeah, exactly. If we want to just look at the insurance companies as a business, it literally doesn't make sense for them to pay us more.
Right. Yeah. And then can you talk about, so you kind of touched on the administrative realities of dealing with insurance. Do you have a billing company or do you do it all in-house?
Yeah, so we do it all in house, and I think that helps us like keep things cleaned up. Jackie at the front desk, she's been doing PT billing for 18 years. Um, so she came from a corporate company, and I don't know where I would be without her. Because she is so good at just checking in on all the insurance benefits. She knows the ins and outs of each company. She knows like if she is predicting an issue, she'll be all over it. So it, having her has made us be to like what we are. But our like EMR, our electronic medical system, is very robust as well. So it does we have all the billing and the tracking of all the different like uh, like patient visits that we support or that we submit to the insurance company, and we can track the status of it at all times. So if we start seeing any issues, we can get them on the phone and say, "Hey, what's going on with this?" So
Yeah.
there is an administrative burden. That is a large part of her job, is to make sure that everything's going smoothly, so that the patient doesn't have to deal with it as much.
Right. And you're very lucky to find somebody good because that makes or breaks a clinic. Absolutely.
Yeah.
So we touched a little bit on trends. Do you have any, just philosophically talking about this, do you have any, sort of predictions or what's the future of PT look like? I mean, now we're entering the age of AI and, entrepreneurial sort of business and things like that. Any
Mhm.
thoughts?
Yeah, it's gonna be interesting what the insurances do over the next 1 to 2 years. I do think that there's going to be some drastic changes, um, and we almost need some drastic changes to occur to start hinting towards maybe a healthcare reform. But we won't go that far. Staying in like PT specific, I see a lot more like private practices popping up. Maybe trying to do like hybrid or cash pay. Um, more people aligning with what we're noticing now. I think that we're kind of like ahead of the curve in the way that we're thinking. Um, but I see more people trying to do this and just trying to serve the people. That's what I hope anyway, is that we see more of the patient first, profit second, and trying to almost make a stand to these insurance companies in a way.
Right. Well, and on top of that, I think the skill set that we have is not just to treat an ailment or just to rehab somebody from surgery, for example. Our skill set also includes the ability to prevent and maintain
Mm.
function
Hmm.
over the lifespan.
Yeah,
And
absolutely.
that unfortunately is not covered by insurance. And
Hmm.
so I think that's where a lot of people find physical therapists that are out of network because they can do that work with the knowledge of
Hmm.
a doctor of physical therapy. We went to school for a really long time for this,
Right,
believe it or
absolutely.
not. Yeah, but we can help somebody stay active for
Hmm.
much longer.
Yeah,
Um,
that's a great point. That is where the profession needs to go. Out insurance aside, um, I'm seeing so many more people, and I do this myself. Is preventative care. Probably 35-40% of my patients are self-pay preventative care, and then another 15 to 20% just self-pay, and then I see insurance. And then we have more insurance spread throughout the practice. But meeting people maybe on their injury and their rehab journey, and then educating them to the point where they know so much about why they came in that they are starting to implement ways to change their lifestyle. And that's going to feed right into what you were talking about. Like, we have the knowledge and the skill set to teach our patients that this is how the body's like supposed to move. This is what you in your life, like, you're combating, like you're sitting at your desk, this and that. So like, in order to have optimal like longevity and a good lifespan, we need to be doing this and this, and we can tailor your workouts for you like with this, and this is how we're going to prevent this injury coming up because you do this all day. um it's really cool, and it's really really fun to get past that injury side of things, and like, it's like human performance optimization. Like, that's what it is.
yeah, and our generation and even, slightly above, slightly below, everybody works out. Everybody
Mhm.
has a sport that they do. And you're right, getting beyond that injury kind of stage and making them perform at whatever they love to do that keeps them
Mhm.
active for as long as possible and in the most optimal kind of way.
Right.
So let's talk about how you and I can work together. So
Yeah.
I think there is a place for both insurance-based care and then also for cash-based care. And you have that hybrid model, so you kind of have a little bit of both under one umbrella.
Sure.
Um, but I think, well, I'll let you answer first.
Yeah. I think that it's really like a match. It's a really good match right now, especially in this model that we're both trying to survive in, where insurance is dominating, and that's not a good thing. um, so like, I think the way that you and I can work together, and actually I have somebody I want to talk about um, at some point, but is like, if we find somebody that maybe they come to us like with low back pain or something like that, we're trying to get them to respond to some core activation cueing and things like that, but they can't get that good activation pattern. Well, there might be something internal going on, more pelvic floor. What's their history? Have they had kids? So like, the one right now, she's mid 40s. She's having some issues, but our cues aren't working, and we're kind of sensing that there might be some internal um, complications on the getting that pelvic floor to activate. So that would be an example of how we could refer someone to you, so like they can learn about their bodies, and
Yeah.
then they can work with you for however that long a plan of care, and then they're like, okay, well, I want to keep using my insurance. Well, then they can come back, kind of things like that.
Right. Yeah, I totally agree. So there can be a good mixture between, accessibility and then very specialized care. What I do is very niche.
Mm-hmm.
Um, and so I would be happy to see the person, and the pelvic floor, believe it or not, is doesn't take that long. Most diagnoses don't take that long unless it's something like chronic pain or sort of trauma induced something. But for the most part, things like that people experience postpartum and incontinence and poor breathing patterns and scar tissue, maybe trigger points inside the pelvic floor. It doesn't take too long to get that coordinated. And
Mm-hmm.
then, I'm more than happy to send them to a place where they can use their insurance, which, where it's more accessible for them to maybe come twice a week versus once a week. And I think there's enough room for all of us in this industry. And I think the more we work together to help people, because it's all we want to do, um, I think there's room for us to always work together.
Absolutely. And I was listening to a couple of your podcasts, and the one that stuck out to me was the ozone therapy one. That was the one that I listened to last, and I'm just like, because I've always had the idea of doing a podcast similar to what you're doing. So I'm glad you're doing it. And I want to do whatever I can to support it, because like this is a great way for us to network with providers who are thinking like this. And we can then learn, okay, so I'm dealing with this patient, they have chronic pain, but how can ozone therapy help them, right? Like that can take what I'm doing in PT above and beyond. And knowing these things and having access to these providers who just get it, is going to be a thing of beauty as we can keep building this network.
And there are so many. And through doing this and through my own networking outside of this, it's amazing how many there's almost like the Western medicine world, the insurance world, and then there's like the healing world.
Yeah.
And there are so many practitioners who are thinking outside the box, who are thinking for themselves, and being out of the network are able to give people such incredible outcomes that maybe traditional medicine can't, or
Mhm.
maybe traditional medicine partially can help, or in the acute sense they can treat the sick but they can't necessarily, how some people say it's a sick system, not a health care system,
There's some truth to that. Yeah.
yeah.
Like we need both, but
Yeah,
we got to
we
know
do need both.
when to utilize each.
Exactly. Yeah.
Yeah.
Well, thank you so much for coming on. I think there's like a million other topics that you and I could talk about being in the
Yeah.
same field.
This could get a little contagious.
Yeah, yeah, yeah. I mean, we definitely, I mean, this is our bread and butter. So,
Mhm.
so it's always fun to talk to another PT who's passionate about helping others. So thank you so much for being here, and
Absolutely.
hopefully we can do it again.
Yeah, thanks for having me. This has been awesome.
Thank you so much to Dr. Derrik Faunt for joining me today and sharing such an honest and thoughtful perspective on the insurance model in physical therapy. Conversations like this are so important because they help us understand the realities behind the care we receive and the choices clinicians make to best support their patients. I hope today's episode gave you clarity, sparked curiosity, and helped you feel more empowered when navigating your own healthcare options. Whether you work with an insurance-based clinic, a cash-based provider, or a combination of both, the most important thing is finding the care that truly serves you. As always, thank you for tuning in to Sage Connections. If you enjoyed this conversation, please subscribe, share the episode with someone who might benefit, and leave a review. It helps us continue to grow this community and bring more meaningful conversations your way. Until next time, take care of your health and your wellness.